Today we are breaking down the next generation NCLEX question types you must master. These formats are designed to test your clinical judgment, not just recall. Let's start with the extended multiple response. Think of this as the new select all that apply, but with a major change: partial credit. The exam will present a scenario. For instance, a client with worsening heart failure. It might ask which of the 6 listed signs and symptoms require immediate follow-up. You might need to select 3 or 4 correct answers. The key is that you get points for each correct option you select, and you do not lose points for incorrect selections. This is a huge shift. Your strategy is no longer about all or nothing. It's about identifying every correct piece of data. Next is the extended drag and drop. This question tests your ability to prioritize and sequence. Imagine a question that gives you 6 steps for inserting an indwelling catheter. You must drag and drop the necessary steps into the correct order. The exam trap here is not just knowing the steps, but understanding the critical order of actions, like maintaining sterility after cleansing the meatus, but before inserting the catheter. A single misplaced step can demonstrate a lack of safe practice. Then we have the Cloze Drop-Down. This item presents a sentence or a short paragraph, like a nursing note, with 1 or more drop-down menus. For a client with a new diagnosis of diabetes, a sentence might read, "The nurse should first address the client's drop-down menu before providing meal planning education." The options might be current blood glucose level, readiness to learn, or family support system. While all are important, the most immediate nursing assessment is the readiness to learn, making it the correct answer for that specific blank. These questions test your ability to choose the most precise term in a specific context. The enhanced hotspot question asks you to highlight relevant information within a client's chart, like a nursing note or a lab report. For a patient who just had a cast placed on their leg, the note might describe the client's assessment findings. The question will ask you to highlight the findings that suggest a potential complication. You would need to click and drag to highlight the entire phrase, such as "toes are cool to the touch and capillary refill is 4 seconds." The exam trap is not highlighting the complete thought, or only selecting a single word like cool. You must identify the full supporting data. Finally, let's look at the matrix questions. These appear in a grid format. A matrix multiple-choice question will give you a list of potential nursing interventions in a row and ask you to select the one that is appropriate, contraindicated, or essential for the client's condition listed in the column. You pick only one option per row. The matrix multiple response is more complex. For a client receiving multiple medications, each row might be a potential side effect, and you would have to select which medication in each column could cause it. You could select multiple boxes in any row or column. It's testing your ability to see complex relationships between many data points. To succeed with these new formats, remember this simple phrase for NGN: don't just select all. Instead, you must collect all the right data. Your goal is to gather every piece of correct information the question offers you, because partial credit rewards you for everything you get right. This changes the entire approach from fear of a wrong answer to confidence in identifying each correct one. Master this mindset, and you will be able to navigate the NGN with confidence.